Hi everyone, welcome back to my channel. If you're an IEN preparing for your NCAS CBA, then this video is for you. I know it can be overwhelming, but with the right approach, you can do this confidently. Today, I'm going to walk you through key topics you need to focus on, study materials that you can use, and also memorization techniques that you can use to help you remember all that information you've been studying for. So let's dive right in. And I suggest you grab your notebook, pen, and tea, and let's get started. First, let's discuss what is CBA. So CBA is part of the NCAS assessment. It's a computer-based assessment. So this test is to evaluate your nursing critical skills, your nursing knowledge, and nursing judgment in Canadian context. You will be given a multiple choice question based on clinical case scenarios. So it's less about memorizing information, but more about applying that knowledge in real life situations. Now let's discuss what are the main areas you need to focus on. So based on past candidates, the must-study topics are fundamentals of nursing. So think about pain management, patient safety, infection control, client-centered care, patient's hygiene, and what are the interventions that you need to do in providing that to your patient. Second would be medical surgical nursing. So this is more pathophysiology and applying that in real life situations. So based on your critical thinking skills, what kind of interventions are you going to be providing that is focused on respiratory system, cardiovascular, GI, GU, and also focusing on main chronic diseases like diabetes, hypertension, cardiovascular diseases. Next up would be pharmacology. So you need to be familiar with drug classes, more specifically antibiotics, cardiovascular medications, and key nursing actions that you need to be aware of when you are giving this kind of medications. Also ensure that you know your 10 rights of medication administration. Lastly, ethics and legalities in nursing. So be familiar with Canadian standards on informed consent, confidentiality, cultural competency. Those are crucial information that you need to focus on as well. And make sure that you also study ethics case scenarios. So how you can apply those nursing knowledge on ethics legalities in real life situation. Now let's discuss recommended study materials. To be successful in passing your CBA, you need to use the best study resources out there. So some recommendations are using NCLEX-RN review books. Although NCLEX is not identical to CBA, you can use this book such as Saunders or Kaplan to learn about foundational knowledge and also learn how to read case scenario questions and how to use critical thinking in answering this type of questions. In addition, you can also use Canadian RN prep guides such as Mosby's Comprehensive Review of Nursing. You can borrow this type of books as well in the library so you don't have to purchase it, or try to find it online textbooks so then you can get it for a cheaper price. Another thing are using apps, so such as UWorld. So if you're practicing CBA type questions or identical to that, so it's more like NCLEX type questions, you just need to get used to practicing those questions over and over so you can see the team in terms of how are they asking this type of questions. In addition, you can also go to the NCAS Resource Center or Inspire Global Assessment, it's called now, and they have sample questions that you can practice on, but they also have explanation about the CBA and also the SLA. So make sure you review that prior to your exam. All right, let's talk about memorization. Preparing for an exam that covers a lot of information, it helps if you have a few tricks up your sleeve. So some memorization techniques that I like to use is chunking. Chunking means having a big topic and dividing it in chunks. So for example, if you're studying for pharmacology, instead of studying for cardiovascular medications all at once, is you can divide it in chunks. So for example, dividing it in high blood pressure medications or anticoagulants. And you can do it for pathophysiology as well. One of my favorite study technique and something that I used when I was in nursing school and when I was studying for my NCLEX is the teach back method. So this is when you pretend to teach it to someone else. So grab a friend, grab a family member, or a fellow IEN as well, and try to teach an information to someone, because this will reinforce you to simplify that information, and it will also reinforce your knowledge and what you know already. You can also use mind mapping when you are studying for your CBA and even for your SLA. So mind mapping is using visual connections linking concepts. So for example, let's use respiratory conditions. You can create a map linking different respiratory illnesses and what are the similarities in terms of their nursing interventions, medications that you can give, and any symptoms as well. Next, repetition. If you are studying every day, and it doesn't have to be long, it can be half an hour every day or even an hour if you can, and just repeating that over and over because that will help you retain information in the long term. Let's finish it off with a few tips for the actual exam day. So during the exam day, as much as possible, try to stay calm. Remember that you have prepared for this, you're a nurse already, so trust your knowledge. And in between questions, if you can, take a few deep breaths. Next, read questions carefully. So remember that the CBA focuses on real world application. So make sure you understand what the question is asking you, what's the case scenario before choosing the answer. Third, pace yourself. So remember that the CBA is a time assessment. So don't spend too long on one question. If you're unsure what's the right answer, just make an educated guess and then move on. Don't stay stuck in that one question. Focus on the question right in front of you. Lastly, always use your nursing judgment and your critical thinking skills. So when you're doing a case scenario for the CBA or when you're answering a question, try to put yourself in that scenario. Try to put yourself in that real life situation. So you're a nurse in Canada. What would you do in case this is happening in front of you? That usually guides you to the right answer. And that's it. I hope these tips help you feel more confident about preparing for your CBA. I know that preparing for the CBA and even the SLA is tough, but with the right materials and the right focus, you can definitely do this. If you like this video, please don't forget to like, subscribe, and share it with other international nurses. Let's help each other succeed. And I wish you all the best in preparing for your CBA and your SLA, and see you in the next video. Thank you for watching.
If you enjoyed this video or found it helpful and would like to support this channel in a simple way, please give this video a like below, subscribe, and hit the bell notification so you don't miss any future videos. I will see you soon.